Good evening everyone. So welcome back to my channel. So today we'll be solving the PYQs after seeing the paper of neet UG. I realized that the questions were from very much related to the previous year questions. So solving PYQs is must. This is my ultimate advice. If you want to score good in any exam, first master these previous year questions, because once you understand the pattern of the exam, pattern of the questions, how it is asked, how you have to manage, solving PYQs is very important.
Properly. So just before beginning, let me confirm whether my audio, everything is good or not. Anyone is watching, you can respond to whether I'm perfectly audible or not. Is there any disturbance right now? So we are going to solve EYQs. I'm very excited for it because this is the ultimate thing what we need. Okay, to ace in the exam. Okay. PYQs are must, whether it is any examination, PYQs is must. You understand the, physiology of the functioning of the examiner's mind, okay? So first we are doing with the community medicine. Yep, we are doing with the community medicine. Oh, how to reach to the paper? 1 second, let me. How to reach the paper? Um, okay, fine. Uh-huh. So we are in the community medicine, need 2021 paper. This is 2514. So we are dealing with a question paper, okay? Here is the answer and here the question. Okay, in community medicine, I don't know how I'm conducting this slide. I have to change some settings. It should not be vertical because it will be not visible if it is vertical. But I can't do anything now because the settings have already changed. I'm literally sorry for that. You can just zoom it out and watch. Okay. So dealing with the NEET 2021 community medicine question paper. Okay. So previous questions are must before sitting in the exam. Okay. Alright. So let's begin. If I'm perfectly audible, please give a thumbs up and you can comment audible. Okay. Let's begin. So, which of the following thermometers is used to measure the low air velocity rather than cooling power of the air? So, which is the best device to measure the low air velocity rather than cooling power of the air? Low air velocity used to measure low air velocity rather than cooling power of the air. So here we need to measure the velocity of the air. So it is kata thermometer. The correct answer is kata thermometer, not globe, not wet globe, not dial. Okay. See, kata thermometer is used to measure the low air velocity rather than the cooling power of the air. It was originally used to measure the cooling power of the air, that is air temperature, humidity, air movement. But currently it is used only as an anemometer to measure low air velocities. A wet kata reading of 20 and above and a dry kata reading of 6 and above were taken as indices of thermal comfort. Kata thermometer is shown here. This is the kata thermometer. Okay, other options like globe thermometer is used for direct measurement of mean radiant temperature of the surrounding. Wet globe thermometer consists of the dial. This wet globe thermometer, it consists of the dial thermometer. It is of a dial thermometer. It provides a measure of the cooling capacity of the working environment. Cooling capacity of the working. So correct answer is kata thermometer. It is used to measure the low velocity, low air velocity, okay, rather than the cooling power of the air. Rather than measuring the cooling power of the air, it measures the low air velocity. It was originally used to measure the cooling power of the air, like air temperature, humidity, movement, but currently it is used as an anemometer to measure low air velocities. So it is currently used as anemometer. There is an outbreak of buboes in the community. What is the vector responsible for the condition? So buboes, bubonic plague. So what is the vector? Vector is the plague for plague. Vector is the rat, rat flea. Okay, rat flea. The insects which are present on the rat, which feed on the dead rat and transmit to the human. Then, okay. So it also transmits murine typhus, chigonosis, and hymenophilis. The vector for bubonic plague is Xenophila Chiopis. Xenophila Chiopis. So this is the Xenophila Chiopis. It is also called a rat flea. Okay, it is also called a rat flea. If I'm audible properly, please show me a thumbs up. So there is an outbreak of buboes, that is plague. So the vector responsible for it is rat flea. It is also called Xenophilus Chiopis. This is also called Xenophilus Chiopis. The rat flea is also called Xenophilus Chiopis. So here, not the common name, but the scientific name has been asked. So it's important to remember the scientific name also. It also transmits murine typhus, chigonosis, and Hymenopsis diminuta. It can be identified by the presence of a conical shaped head. The head is conical shape. Here you can see the head is conical shape. The head is conical shape. How is the head, guys? The head is conical shape. I guess I should rotate my screen so that you can see the full thing, right? Just a minute. Yes, yes, I'm back. Don't leave. Okay, just a minute, guys. Just a minute. Yeah. So here's the question. Okay, fine. So there is an outbreak of buboes. Buboes is a plague, okay? So the spectre responsible for spreading is Xenopsilla chiopis. Xenopsilla chiopis. It is also called a rat flea. Common name what we know is rat flea. But in the exam they are asking the scientific name. I have to remember. So its scientific name is Xenopsilus chiopis. Okay, I have to remember the scientific name. Okay, so this rat flea, what they do, they eat on the dead rat which is affected by plague, and then they bite the humans, and they spread the plague in this manner. Okay, the rat flea, they also transfer murine typhus. They also transmit murine typhus, chigonosis, Hymenopsis diminuta. It can be identified by the presence of a conical shaped head, presence of thorax. So they have a conical shaped head. The head is conical shape, presence of thorax, abdomen, and three pairs of legs. They have three pairs of legs. Plague is a zoonotic disease which is spread from the animals caused by Yersinia pestis. Yersinia pestis. Yersinia pestis is a gram negative and it is a non-motile. Everything is negative. Non-motile, negative, gram negative. It is a cocobacillus. It looks like a bacillus as well as coccus. Round as well as short shape. Okay. That exhibits bipolar staining with special stains like Wiesen stain. Bipolar stain. The reservoir of the infection is wild rodents like field mice, gerbil, skunks, etc. In India, Tartara indica is the main reservoir. Tartara indica. The important vector of plague is rat flea. It is also called as Xeropsilla caupis. Okay, so this is the conical shaped head. It has abdomen, thorax, and three pairs of legs. One, two, three. Three pairs of legs. Okay, three pairs of legs. Okay. Humans acquire the disease by the bite of infected flea, by direct contact with the tissues of the infected animal, or by droplet infection from cases of pneumonic plague. So, from human to human transmission is also there with the tissues of the infected or by droplet from cases of pneumonic plague. It is very rare, but the thing is, from animal to human transmission is by the vector Xeropsilla caupis. Bubonic plague, most common type of disease. The patient develops a sudden fever. What are the symptoms? Patient will have fever. He will be having chill, headache, painful lymphadenitis. Lymphadenitis. Lymph nodes will be swollen, inflamed, and painful. Within a few days, the lymph nodes in the groin, axilla, or neck enlarge. They enlarge. They become very big. It is called buboes. This is followed by separation of the buboes. Okay, bubonic plagues cannot spread from person to person as the bacilli are locked up in the buboes and do not find a way or easily. So they are packed in the buboes. So from human to human, they cannot spread. But pneumonic plague can spread, but this one cannot spread. Bubonic plagues cannot spread from person to person because bacilli are locked up into the lymph node. Pneumonic plague develops as a complication of bubonic septicemic plague. Spreads within the body to the lungs. Complication of bubonic septicemic plague. Septicemic plague, it occurs when the infection spread to the blood. Other options like the phlebotomus argentips, they belong to the group of sandfly. They belong to the group of sandfly. It transmits Kala Azar. Phlebotomus argentips, they transmit Kala Azar. Kala Azar. Kala Azar, disease caused by other species of sandfly or sandfly fever, oriental sore. This is rat flea. Xenopsilla cauptis. Ixodes ticks, it's a hard tick, transmit Rocky Mountain spotted fever, Russian spring summer encephalitis, Colorado tick fever, tularemia, tick paralysis, and human bubosis. This is the image of Ixodes tick. Female Anopheles mosquito known for malaria and filariasis, but this one not in India, okay? Malaria by female Anopheles, okay? Can be identified by the presence of spotted wings. Wings are spotted. Can you see the spots? Wings are spotted. Spotted wings, okay? Spotted wings. When resting on a surface, they make an angle with the surface. They make an acute angle with the surface, okay? Now let's solve question number 3. Actually, this should be up. Okay, so okay, so this was the question number 2. Female Anopheles responsible for malaria and also paralysis in some countries, but not in India. So mostly malaria. They have spotted wings, and the mosquitoes sit with the angle. Okay, Ixodes tick. They're responsible for Rocky Mountain fever, and Phlebotomus urgentix. These are responsible for the Phlebotomus urgentix. These are responsible for this Kala Azar. Kala Azar. Okay. Now moving to next question. So the answer for the second one was Xenopsilosis sciopis, which is responsible for bubonic plague. Vector. Okay. The Pathanamthitta district of Kerala was affected by floods, and the government distributed doxycycline tablets for prophylaxis. Which other chemical will be distributed along with it? So the question is in floods they were giving doxycycline. What else they can distribute along with the doxycycline? Along with the doxycycline, what else they can distribute? So the correct answer is malathion, because malathion is an insecticide. Is an insecticide. It can prevent the spread of other diseases. Okay, malathion can be distributed. So leptospirosis followed by acute diarrheal disease and dengue are most commonly prevalent following floods in Kerala. Malathion will be choice of insecticides used in this scenario. So malathion, okay? Because two things which are very common is leptospirosis, leptospirosis, then diarrhea, and the next is dengue. These are common during floods. Okay. Malathion is an insecticide, so it can be used. Leptospirosis is a bacterial zoonotic disease transmitted via water contaminated with rodent urine. That's rodent urine, contaminated with rodent urine. So this bacterial zoonotic disease, leptospirosis, spreads with the contaminated water. Infected rodents excrete large amount of leptospira in their urine, and floods facilitate the spread of the organism. Prevention of leptospirosis: chemoprophylaxis with doxycycline 200 mg once a week for 6 weeks is recommended for high-risk population endemic areas. In case of fever, doxycycline 100 mg twice a day for 7 days is the recommended dose. Rubber shoes and gloves should be used. Anti-rodent measures must be taken. Mapping of water bodies must be done to establish a proper drainage system. Other diseases usually transmitted after floods are malaria, cholera, diarrheal diseases, hepatitis A. Hepatitis A is not bloodborne; it is food and waterborne. Hepatitis E also. Okay. General measures to control disease during floods are: chlorine tablets are distributed to disinfect the household water supply. One tablet can chlorinate 20 liters of water. Drinking water disinfectants like bleaching powder are also used. Malathion is an organophosphorus synthetic insecticide used for vector control under to mosquitoes, and it is a contact poison that is sprayed using ultralight volume fogging machines. Ultralight volume fogging machines, indoor residual sprays with insecticides and herbicides like abate for drinking water are recommended. Tetanus booster dose for previously vaccinated people. Open injuries may be indicated. General hygiene sanitary measures must be followed. Other health risks posed by let's say hypothermia, respiratory tract infections, snake bites, injuries, drowning. Zinc phosphide is a rodenticide used to kill animals like mice, rats. It is a highly toxic compound can produce toxicity by oral ingestion, inhalation to damage skin. Linde is used as an insecticide for hardwood logs. Linden is used as an insecticide for hardwood logs, lumber and crops. It also it also has topical pediculicidal and scabicidal activities and is used in pet treatment. Paris green. Okay, it is an insecticide that is not much used due to availability of lesser phytotoxic agents. So linden is a insecticide for hardwood logs, lumber and crops. It also has topical pediculicidal and scabicidal activities and is used in pest treatment, pet treatment. Okay. Next question. So for the third one, the correct answer is malathion. Yeah, because it is an insecticide, it prevents dengue and spread of malaria and all. Zinc phosphide, it kills rats and mice. Okay, it is a rodenticide. It is highly toxic, so that's why we cannot distribute it like that. Malathion is organophosphorus. Okay. Following admission of a road traffic accident case, there is spillage of blood on the hospital floor. Which disinfectant will you use to clean the floor after use of strong disinfectant? Okay, a strong disinfectant should be used. What is that? You have to use sodium hypochlorite. Sodium hypochlorite. So, the disinfectant used in blood and body fluid spillage management is sodium hypochlorite because sodium hypochlorite is a stronger disinfectant. Procedure to be followed is first you have to wear a pair of non-sterile gloves. Gloves. You have to wear gloves. Broken glass, if any of the container is cleaned first using tongs or a pan and brush and discard it in the sharp container. Sharps container, okay? Sharps container. Caution is taken to not use the hand, that's why use tongs and brush. Disposable paper towel are used to absorb as much as possible. Okay, you have to put some paper to absorb it. Tissue paper, some paper, towel. Water and detergent are used to clean the surface until visibly clean. Water and detergent are used to clean the surface until visibly clean. Water and detergent. Water and detergent are used to clean the surface until visibly clean. The area is saturated with 0.5% sodium hypochlorite. This is prepared by diluting 5.25% sodium hypochlorite bleach at a 1:10 ratio. The tongs, pan and brush are washed under running water and left to dry. The gloves are removed and discarded. Hands are washed with soap and water using proper technique and dried with a disposable towel. Spillage is recorded in an incident book. The air pollution index chart of 4 consecutive days in Delhi situation is shown in given below. The air quality index of November 23 is classified as. Here the chart is missing. 4 consecutive days in Delhi. The air quality index AQI of November 23 is classified as. According to the data presented in the question, it is not there currently. It's missed printing. The air quality index for 23rd November is 407, which is classified as year. So air quality index is a tool used for effective communication of air quality status on a scale that is easily comprehensible. complex air quality data of various pollutants are compiled to give a single score index value. Nomenclature and color that determine the air pollution of the particular location. So, 8 pollutants are taken into consideration to calculate the AQI. Okay, here 8 are there. Okay, PM10, airborne particulate matter with a diameter of 10 microns or less. So, 8 pollutants are taken into consideration to calculate the AQI. So, PM10, airborne particulate matter with a diameter of 10 microns or less. Okay, another is particulate matter with a diameter of 2.5 or less than 2.5. Nitrogen dioxide NO2, sulfur dioxide SO2, carbon monoxide CO, ozone trioxide O3, NH3 ammonia, PV lead. AQI categories in the range as follows. If it is good, 0 to 50, satisfactory 51 to 100, moderately polluted 101 to 200. But here as per the question, it is 407. Okay, so poor means 200 to 300 and very poor 300 to 400. If it is for between 401 to 500, then it is severe. So since it is 407, then it is classified as severe. So it is classified as severe because it is 40. So it is severe. Okay. It is based on the 8 pollutants. Particulate matter of less than 10 or equal to 10 microns. Particulate matter less than or equal to 2.5 microns. Then NO2 nitrogen oxide, dioxide, SO2 sulfur dioxide, carbon monoxide, ozone, ammonia, lead. Good means 0 to 50, satisfactory 51 to 100, moderately polluted 101 to 200, poor to 201 to 300, very poor 301 to 400, severe 401 to 500. So there is an outbreak of acute encephalitis. Encephalitis is inflammation of the brain parenchyma. Meningitis is inflammation of the meninges of the brain. Itis means inflammation. So encephalitis means parenchyma, brain of parenchyma is inflamed in the community and a vaccination drive is launched. So the point is true about the vaccine given in this condition. So vaccination is launched because there is a acute encephalitis outbreak, whether it is live and subcutaneous, kill and intramuscular, live and intramuscular, kill and subcutaneous. In the given scenario, this is suggestive of Japanese encephalitis, which is the kill vaccine and is administered intramuscularly. Japanese encephalitis. So this acute encephalitis, nothing but Japanese encephalitis, which is a kill vaccine. This vaccine is a kill vaccine and is given intramuscularly. This is caused by a virus called Japanese encephalitis virus. This virus is transmitted by the vector Culex mosquito, female Culex mosquito, transmitted by the bite of the Culex mosquito. Especially Culex Titaniorhynchus and Culex vishnui. Vishnui is common in India, this species. Okay, they present with fever, headache, mild disease form. Still severe disease present with rapid onset of high fever, headache, neck stiffness, disorientation, coma, seizure. They can ischemic paralysis and ultimately death can occur. Killed JE vaccine are gradually replacing live attenuated vaccine. This change is because the kill vaccine are reported to have better immunogenicity than live attenuated vaccine. Inactivated SA1414-2 cells culture derived and inactivated Vero cell culture derived. Live attenuated is 1414-2, actually based on a stable neuroattenuated strain of the JE virus with a yellow fever vaccine acting as a viral vector. Adverse effects of the vaccine include fever and rash. Dose is 0.5 ml. Site live vaccine subcutaneous left upper arm. Killed vaccine is intramuscular anterolateral side of the left mid thigh. Intramuscular killed vaccine. This can be administered up to 15 years of age with a month gap between the two doses. JE virus vaccine has been included in National Immunization Schedule to be administered in endemic areas Uttar Pradesh, Assam, West Bengal, Karnataka in two doses. In two doses. The first dose is administered at 9 to 12 months, 12 completed months. Second dose between 16 to 2 years. Okay. So one is 12 months, matlab 1 year. Okay. Between 9 months to 1 year. Okay. 9 months to 1 year. Other is 16 months to 2 years. So before end of 1 year you have to take, before end of 2 years you have to take chain reactive. Again, the schedule, however, mentions the use of both live and kill vaccine. According to the National Immunization Schedule, both live and kill and inactivated vaccine are now used for vaccination against the JE. So killed one are more immunogenic. So killed and intramuscular. Correct answer is killed and intramuscular. Live one is given subcutaneous. This live one is not given. Killed one is given. Killed one is given. Correct option is B. Killed one is given intramuscular. So it is more immunogenic. Okay, the evaluation based on the treatment given to the patient, clinical management in a healthcare facility measures which of the following. So the evaluation based on the treatment given to the patient, based on treatment given to the patient, clinical management in a healthcare facility. This is called the process. The evaluation based on treatment given to the patient, the clinical management in a healthcare facility measures the process of the medical care. Basic steps of evaluation are follows. Determine what is to be evaluated. Establish standards and criteria, plan the methodology to be analyzed, gather information, analyze, take action, re-evaluate. Three types of evaluation are evaluation of structure, evaluation of process, evaluation of outcome. Okay. Moving to question number 8, a girl child has had recurrent yeast infection and respiratory virus infection since she was 3 months old. Recurrent respiratory virus infection, recurrent yeast infection means her immunity is very low. If the following vaccine is contraindicated considering her immune status, you can't give live vaccine, okay? Give attenuated kill vaccine because the patient's immunity is poor, she's immunocompromised. She should not receive live vaccine like MMR, measles, MMR. This is a live attenuated vaccine which is contraindicated in immunocompromised patients. This is live vaccine. Live vaccine should not be given. Here the organisms are live. Okay, contraindications for live vaccines: immunodeficiency disease, suppressed immune response as a result of leukemia, lymphoma, malignancy, corticosteroid therapy, treatment with alkylating agent, antimetabolic agent, radiation, pregnancy, measles vaccine. For measles is safe and effective with no evidence percent chance of vaccination. Freeze dried kill IPV is a form of kill in or inactivated vaccine. Still contraindication is severe local or general reaction to previous dose. DPT or TD falls under toxoids protein vaccines that are usually highly efficacious and safe immunizing agents. You can give food DPT and TT because it's a toxin. Each of the following is a conditioning influence for malnutrition. Challenging infectious disease, food habits, etc. The conditioning influence for malnutrition. Whether it is child rape, food habits, conditioning influence. Conditioning influence. Ecological factors. It is infectious disease. Okay. Because of the condition, the child is not able to take. There's no issue with the food, socioeconomic, or child rearing. patients cannot able to eat because of the infectious disease. So a conditioning factor that plays a huge role in malnutrition is infectious disease, which causes a vicious cycle where infections cause malnutrition, which in turn causes minor childhood ailments. Diarrheal diseases, intestinal parasites, sneezing, whooping cough, malaria, tuberculosis, significantly as malnutrition. The occurrence of infections are largely based on environmental conditions that the child is exposed to. Cultural influences. Food diets as a result of cultural and regional influences also play a role in malnutrition as far as like food habits, traditions, customs, beliefs, attitudes. Sandwich are largely staples in India. Papaya is avoided as it is thought to cause abortion. Food fats, personal likes and dislikes to certain group of foods. Cooking practices, prolonged boiling of cereal, open pans is loss of nutritive value. Child rearing practices, premature curtailment or of breastfeeding is called child rearing. Okay, socioeconomic factors. Poverty. Poverty plays a huge role. Okay, poverty plays a huge role. Poverty plays a huge role in causing malnutrition, ignorance, insufficiency, lack of knowledge. Food products, the amount of food produced directly proportional to the amount of food consumed. Developed countries have 5.8 hectares of arable land compared to the 0.6 hectares of for India. Even distribution of food among sectors of sales also affected. Services, remedial actions that can be taken by the health sector to reduce malnutrition as follows. Nutrition surveillance continues monitoring factors that affect nutrition groups affected and identified. Urgent care for individuals suffering from severe malnutrition. Supplementary feeds from mothers and child. Health education programs to increase awareness about malnutrition, nutrition value of food. Sometimes because of food habits, because of socioeconomic factors, because of the infectious disease, where the patient cannot eat. So, like you can also come based on malnutrition or answer question. Which of the following is not a component of global hunger index? Is it infant mortality rate or it is uh, under 5 mortality, percentage of undernourished, percentage of undernourished children under 5 years? The correct option is infant mortality rate. This is not a component of global hunger index. Global hunger rate GHI has three dimensions. The three dimensions are measured by indicators. GHI score. GHI score 1 by third into standardized PN. PN is proportional of the population that is undernourished. Population undernourished. 1 by 6 into standardized CWA. This prevalence of wasting children under 5 years of age. By 6 into standardized CST. Chance of stunting in children under 5 years of age. Standardized CM. Children are dying under the age of 5 years of age. Like child mortality, children are under the age of 5 years of age. Percentage of undernourished population, yes, it is included. Percentage of undernourished children under 5 years, okay. Infant mortality is not children under 5 years. Infant is 1 year, but here we are looking for children under 5 years. Under 5 mortality, under 5 undernourished, under 5 undernourished population. A research wants to know whether there is an association of CRP value with the risk of myocardial infarctions too. The group was divided to quintiles and the following table is formed based on the study result. Which of the following statement is true regarding the relationship between CRP and risk of myocardial infarctions too? Association with risk of a master, increasing CRP increase the risk of a mild stroke, increasing CRP decrease risk, and in quintal 1 there is no risk for mild stroke. So the study results increase in CRP increases the risk of MI, increase in CRP increases the risk of myocardial infarction. Native risk is the ratio of the incidence of the disease or death among exposed and the incidence among non-exposed. Incidence of disease or death among exposed by the incidence of disease or death among non-exposed. It is a direct measure of the strength of the association between suspected cause and effect. If the relative risk is 1, it indicates no association. If it is if 1 indicates a positive association, if it is um, relative risk is of 2, higher indicates increase in risk. So according to it, relative risk increase in risk with increase in CRP. The child presented with pharyngitis, a throat swab was obtained and was sent for culture. The culture swab should be discarded in which color bin? So it is an infectious waste. Yellow bin should be the answer. Yellow color bin for waste, laboratory waste. Microbiology laboratory collects autoclaves. Which of the following is the SI unit for the measurement of brightness of light from a point source? Candela. Candela is for brightness of light from a point source. Power of light from a given point source. A pregnant woman whose niece lives with her in the same house contracted varicella. She is pregnant. Niece whose niece lives with her same house contracted varicella. Varicella zoster. She tested negative for serum antibodies against varicella. What would this mean? Negative for serum antibodies are not there. She is immune to zoster, susceptible to chickenpox, varicella zoster. She is immune to chickenpox. She is not immune to chickenpox. She is not immune to varicella zoster. She is susceptible to chickenpox. She is susceptible to chickenpox. She is susceptible. Okay. The school health programs are managed by which of the following? Primary health center, district hospital, or center subdivision center. It is managed by primary health center. Man from Chhattisgarh presenting progressive muscle weakness and expansion. There motor paralysis was seen as a junction. What is the most appropriate history to verify in this patient? Your vaccination diet. Leg spasm is there, progressive muscle weakness is there. Okay. It is strict Lathyrism. He must history of diet we had to ask. What he ate history of diet because it is similar to Lathyrism, spasms, muscle weakness. This, a 10-year-old school child, which of the following vaccines were the answers? History of diet. In a 10-year-old school child, which of the following vaccines is given as a part of immunization program? 10-year-old child. You can give TT, TT or TD is administered. TT or TD is administered. Okay. Due to all age groups. 17 questions done. Now I need set just now the detailed solution for the okay this is like that. Okay. As per the National Tuberculosis Elimination Program, HIV TB prevalence of Dash would deem our district as a high priority district. National Tuberculosis Elimination Program HIV TB prevalence would be how much? National Tuberculosis Program HIV TB prevalence is GT 10%. 10% would deem a district at higher priority. Revised National Tuberculosis Control Program has been revised by Government of India's NTEP. The vision and goals of NTEP respectively are tuberculosis free India with zero deaths, disease and poverty due to tuberculosis, achieve a rapid decline in the burden of TB morbidity mortality while working towards the elimination of TB in India 2025. NTEP has categorized and prioritized the district in the country based on the following criteria: high TB, total TB case notification rate more than 180 per lakh, high TB HIV more than 10% proportional. Okay, next question. India is a country with different cultures and development expertise. Should the physician take to address the patient for better outcomes? He should have good communication, consider the patient's religious and cultural perception. Outcomes statement 1 and 4 are correct. Statement 1 is true. The proper usage of vocabulary that is easy for the patient to understand and special for the patient. The doctor should clarify the patient's interpretation of the word used, thus insisting a good communication for better health outcomes. Statement 2 is not true. An interpreter is needed if the patient is not a native speaker of the language spoken in that region. The interpreter can be a family member above the age of 16 or an independent interpreter. Communication gets affected with open-ended questioning. Getting lost in the double translation, the answer returned might not be adequate for the doctor and the consultation as such becomes longer than usual. Doctor will have to change to a more direct style of questioning to prevent a misunderstanding. Statement is not true while statement false. The personality, culture, and beliefs are important in creating trust. Doctor and patient are an important component in medical interview for better outcomes. The doctor must listen to the patient's concerns and preferences. Still, if the message is not adequate, a good message should have the following: should be in the line with the objective, it needs to be meaningful based on felt needs, clear, understandable, specific, accurate, culturally and socially appropriate. 5-year-old Ram and 3-year-old Sham are Rama Devi's sons. Sham developed a rash, but Rama Devi ignored it, assuming it to be allergy. After 3 days, Ram also developed a rash along with a fever. Out of fear, Rama Devi took Ram to the primary healthcare. The healthcare worker says it is expected to be measles. All correct options. So these options are not given in the question. Statements are correct from the given are correct. Scenario 1 is correct. Ram is the index case as he wanted the first case to come to the attention of the investigating authority. Two is correct from the given clinical scenario, considering the family of Ramadevi is as a unit. Primary case, the first person who gets the communicable is sent to the community. Incubation period from the time of exposure to the development of rash is 7 to 18 days, with an average of 14 days. Now, to develop the rash 3 days after sham, considering the period of communication of rash prior to or 4 days later than the onset of rash. It is evident that sham was an infectious state who has contracted the infection from sham. Post-exposure prophylaxis can be given in the form of a vaccine or immunoglobulin. The vaccine can be given within 2 hours of exposure, while immunoglobulin to receive if were brought to the PHC along with sham. Next, you are measuring a patient's blood pressure at a primary healthcare center when the signal amount of hair and broke and mercury was spilled out on the gun. How will you clean the mercury? Mercury is cleaned by collecting it by using a card onto a sheet of paper and putting the mercury into a jar. After mercury is purified, step should be for isolation of the spill and ventilation of the room, of the area, collection of items to clean the spill, zipper top plastic bag, trash bag, gloves, paper towels, cardboard, skis, squidge, eyedropper, tape, flashlight, powdered sulfur. Clean up the spill. After putting on the glove, the glass pieces are picked and placed onto a towel, rolled and disposed of into a zipper top plastic bag, finally sealed. The beads of mercury are cleaned by using cardboard or a squeeze. They are rolled onto a sheet of paper, disposed into a zipper bag and sealed. Powdered sulfur may be used to absorb small beads that are not visible. Looking for any mist spill using a flashlight. Remove other mercury contaminated items or wipe off any mercury. Okay. Card onto a sheet of paper and put the mercury into a jar. Collect it by sweeping, they are saying. It with a broom and throw it outside. Throw it outside. Wow. No, not at all. Collect it by swooping it and flush it in toilet. No. Collect it by hand and then wash hands with water. Wow. Excellent. Not at all. Because mercury do not touch to the hands, okay? Proper disposal of contaminated, clean up material. Keep the area well ventilated 24 hours. Keep pets and children away from the area. The vacuum cleaner or broom to clean the spill should be avoided. This will break the mercury into small droplets and spread it further. Should not be poured down any drain. Do not use a washing machine to clean the clothes contaminated mercury. This can contaminate the water and sewage. Shoes or cleaning should not be worn. Powdered sulfur may be used to absorb small beads that are not visible. Hmm. So the following is two statements regarding measures to prevent typhoid transmission in the community. Vaccine administration is the best method of preventing transmission. Hygiene by clean sanitation control. Typhoid vaccine. Is that hygiene practices and clean sanitation control more important than typhoid vaccine? Typhoid vaccine is not that effective. Okay. It helps in breaking the chain of transmission. Hygiene practices, clean sanitation. Typhoid causes salmonella typhi transmitted human to fecal route. Hygiene is important. Which of the following is true about the management of a baby boy to an HIV positive mother? If replacement feeding neonates should be tested for HIV. If negative, RT is not required. In exclusive breastfeeding, give nevirapine for 6 months only when baby is positive. If replacement feeding, the neonate need not receive nevirapine. if HIV negative. If exclusive replacement feeding, give nevirapine for 6 weeks even if the baby is negative. If exclusive replacement feeding is done, give nevirapine for 6 weeks. Okay, this is the correct one. Okay. National AIDS Control Organization program. NACO has recommended following for an infant born to HIV positive mother. According to National AIDS Control Organization, antiretroviral therapy should be given to all HIV positive pregnant women, including during labor hours of breastfeeding. They are started on triple drug ART. ART should be given irrespective of the CD4 count and clinical stage and should be continued lifelong. Into CD4 count. Immediate care of HIV exposed infants includes wiping of baby's mouth and nostrils, handling of infants with gloves, immediate cord clamping, initiation of feeding. Infant born to an HIV positive mother should be breastfeed exclusively. Replacement feeds exclusive for 6 months of age. Infants should receive ARV prophylaxis. A single drug or dual drug regimen is required depending on the risk of transmission. Low risk infants are those born to mothers with a low viral load which is detected after 32 weeks of pregnancy till delivery. These are those born to HIV. High risk those born to HIV positive mothers not on ART with viral load not estimated beyond 32 weeks. Viral load not suppressed 32 weeks or diagnosed with HIV within 6 weeks. Low risk infants are those, so for them syrup nevirapine or zidovudin should be given. Zidovudin or nevirapine which are ART therapies, okay? Birth to 6 weeks of age irrespective of feeding. Birth to 6 weeks have to give. High risk infants syrup nevirapine plus syrup zidovudin both have to give exclusive replacement feeding, and birth to 6 weeks exclusive breastfeeding. Birth to 12 weeks. What is the branch of statistics dealing with describing the internal collection of data? Collection of data. Descriptive statistics. Descriptive statistics. Okay, next is isolation separate room is meant for which of the following airborne infection is mandatory for measles. 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 It is transmitted droplet infection as well as via airborne. So the period of isolation is from onset of symptom, fourth day of rash. It is different separation of infected person and animals in the period of communication places to prevent indirect transmission of infection. Via bite of scratch from an infected animal, contraction of rabies by an additional voice is extremely rare. Human to human that is possible but not being confirmed. Zoonotic disease. Okay, all the following cause widening of confidence interval except increase in sample size. Increase in sample size. Increase in sample size lead to narrower confidence interval. Visual lymphadenum is being managed as shown in the given image. What is the level of prevention done here? Okay, so the patient is doing something here. So here hygiene, he's washing, I think the bucket is there and he's washing. So then further disability, the secondary vital. So this is disability limitation. because here already you can see some lymphadenitis can be seen. So this one leg is there. So disability limitation is a mode of intervention here. Okay, next question. So the following indicates can help in determining whether the health system is given importance to helping leprosy in the community. A newly diagnosed patient with grade 2 disability is used in determining whether the health system is given importance and leprosy in the community. National Leprosy Eradication Program 1983 controlled disease to a reduction in the infection and infective source, breaking the chain of disease transmission. Functions under National Health Mission. Vision is Leprosy Free India. Disability prevention, medical rehabilitation, priority of the program is to provide quality service free of cost to all people through the integrated healthcare system. Rate to disabilities among new cases, females among new cases, proportion of MB among new cases, proportion of child among new cases with continuous child rate per 1 lakh population, scheduled cast new case detection rate, scheduled new case detection rate. The following can help in determining whether the healthcare system giving the body scientific literacy or not. First in the community, the proportion of newly diagnosed patients with grade 2 disability is useful. So grade 2 disability, okay. Which of the following is true regarding the vaccine vial monitor? Vaccine vial monitor heat sensitive indicators are generally used to monitor heat exposure of the vaccine, determine vaccine viability as the vaccine vial moves across supply chain. It records cumulative heat exposure through gradual change in color. The color of the inner square is the same, is darker, is darker than, so is the darker. Okay, so it is if the color of the inner square is the same or is darker than the outer circle, it indicates the vaccine has been exposed to high temperature, should be discarded. If the color of the inner square is same or is darker than outer circle, it indicates the vaccine has to be discarded. Now let's move to some other subject. So I'm looking for forensic medicine here. Actually, it's not found. Hmm. 2678. Let's go for 2678. Okay. Which of the following is incorrect regarding the image shown? So this image is of a conite. Only the roots of this plant are poisonous. This is wrong because all parts of this plant are poisonous. Causes AV block. It is a cardiac poison. It causes AV block, bradycardia. This is correct. Incorrect is asking. So this is the option is the answer. Drug of choice for poisoning is atropine. Atropine is used in the treatment of toxicity. Correct. Mitha zahar is one of the variety of this plant. Yes, mitha zahar. Monkhud, mitha zahar, bish, bik. These are the varieties. So mitha zahar. A girl was allegedly kidnapped by a man in court. She says that she is a major and is married to the man. X-ray images of her elbow, wrist, and pelvis are given. Approximate age of the girl. Elbow, pelvis, and wrist are given. The most approximate age is between 21 to 22 years. Okay. Since the scale tuberosity is fused, the girl must be aged between 10 to 21 years. Scale tuberosity is fused here. That's it. So, elbow joint centers lower end of humerus, upper end of radius, olecranon of ulna. 16 years. Fusion will be there. Everything is fused. Wrist joint centers 19 years fused. The bone center head of femur greater and lower trochanter is tuberosity 22 years. First hand knowledge rule is applicable to doctor. First one is obligatory. The common witness who gives evidence about the facts observed or perceived by him. So it is a common witness. It is a common witness. Because the first hand knowledge rule is applicable to common witness who gives evidence about the facts observed or perceived by him. Okay. Expert witness is someone who has been trained or is skilled or has knowledge or experience and is able to draw conclusions from the facts observed by him. Doctors' handwriting, fingerprints, firearms, experts come under this category. Okay, next is crown rump length is 21 centimeter. Length of lower limb is 10 centimeter. Gestational age of the fetus is. Okay, we can find out this 1.5 into 21 centimeter. How much? 5, 10, 1 square root of this. See, gestational age and female. Crown rump length plus length of lower crown heel length. Crown heel length, you can directly find out 21 plus 10, 31. So according to the square root of crown heel length, when the crown heel length is 25 centimeter or less, age in months, crown heel length divided by 5. So here it is more than 25, right? So you have to divide it by 5. So you have to divide it by 5. It's not 31 by 5. 5 0 30. 6 to 7. So if you have to add the crown rim length plus this centimeters. Okay, so basically this you have that lower limb length, crown heel length you will get. If it is less than 25 centimeter, square root. If it is more than 25 centimeter, then divide it by 5. You get the answer. Identify the correct pair, mummification, adiposity, marbling, lividity of the body. Okay, so this one you can see this looking like a mummification. This one is looking like a mummification, mummy. So 3 is 3. Yeah, third one is 3. What's wrong here? 3 is 3. Adipose seed. This is adipose seed. Something wrong with the options here. So the first image is marbling. Marbling, discussion of superficial veins due to formation of self-hemoglobin. It starts in 24 hours and becomes prominent in 36 to 48 hours. So it's marbling. This is postmortem lividity. Postmortem stagnation, postmortem hypostasis, postmortem staining, labomotor stagnation, this is in the dependent portions of the body due to engorged vessels showing to the skin. Modification, absence of moisture and continuous action of dry and warm air. Adiposity forms under warm and humid weather due to hydrolysis of lipids. Match the following: heroin, E joint, LSD, ganja, acid, brown sugar, acid. Heroin is brown sugar, mannitol. Ethylene dioxide, methamphetamine, E. LSD is acid. LSD is acid, guys. Quite tired now. I will get tired. I should start taking my vitamins and iron. Really tired. Okay. Mm. Heroin is brown sugar. Heroin is brown sugar or smack dope. Ganja is a joint reefer, weed, pot, grass, purple haze. Ethylene dioxide, methamphetamine is weed. Weed. LSD is acid. The following trait is a feature of the female skull. Female skull. Feature of female skull. Female skull, larger teeth, frontal maxillofacial are large. Frontal and parietal eminences are larger. Supratympanic crest is present. Feature of female skull. Feature of female skull. Large teeth, frontal maxilla and frontal parietal means tympanic system. Frontal parietal means it's larger. Frontal and parietal eminences. These are larger. Okay. Frontal and parietal eminences are larger in females. Females. Frontal and parietal eminences are larger. Differentiating feature between female and female skull is size is large in male, female skull size is small. Females have a smooth architecture, smooth. Male has rugged. Supraorbital ridge is less prominent in female, more prominent in male. Mastoid process is prominent in males, less prominent in female. Occipital region marked muscle markings in male, no marked muscle markings in female. Frontal eminences. Frontal eminences small in females and males, small in males, large in females. Parietal small and large. So your frontal and parietal eminence is larger in female skull. Orbit square with round margins, round with sharp margins. Large broad ramus, mandible, mandible कहते हैं. Large broad ramus, here small ramus. Chin shape, U shape in males, V shape in females. E shape, U shape. Chin. Mandible, large broad ramus. Small ramus. Okay, next question. The person starts to serve a second employer. The new employee is responsible for his actions by when an employee is being borrowed, the lending employer temporarily surrenders thus control over this worker and the borrowing employer temporarily assumes control. Known as borrowed servant doctrine. Known as borrowed servant doctrine. If a person starts to serve a second employer, the new employer is responsible for his actions. So when an employer is being borrowed, when the employee is being borrowed, the lending employer temporarily surrenders control over this worker and the borrowing employer temporarily assumes control. This is known as borrowed servant doctrine. Vicarious liability is by which the employer is responsible for his employee's negligence if such activity occurs in the course of the employment is within its scope. Borrowed servant doctrine. Verify the following post-mortem changes. This is stagulation. This is what? Stagulation. Post-mortem lividity. This is post-mortem lividity. Stagulation, hypostasis, process staining, never notice dependent parts of the body. You can engorged vessels showing through the skin. All the following statement is true about the given condition except this is human bite mark. Bite mark. Human bite mark. Okay. Photograph is taken with two scales at the right angle to one another in the horizontal plane. So human bites are usually sensitive to authentic caused by front incisors and swabs of bite marks should be taken immediately using a swab moistened with sterile water. Sterile water. Correct. Okay, next. A sample of the control area adjacent to the mark and the victim's saliva should also be taken using swab moistened sterile water. This most commonly caused by incisors and canines. Yes, front facing incisors and canines. Photograph is taken with two scales at right angles to one another in the vertical plane. Is taken with two scales at right angle to one another in horizontal plane. This is known. It's not vertical horizontal. 3D imaging is possible in the given everything is done in the image is measurable with high precision. So plastic substance such as rubber is laid over the bite mark which produces a permanent negative cast. A 18-year-old girl was brought to the police. Financial examination revealed the finding as seen below. These findings are indicative of findings are not clean. Findings is a false version. The examination finding of a separated labia majora, of flabby labia minora, and a porchid stare are indicative of forceful penetration. Usually gets rupture with the first act of sexual intercourse. However, in some cases, intact in spite of sexual, it is indicative of false virgin. So here the examination findings are for separated labia majora, separated labia minora flabby, and porchid tear indicative of forceful penetration. So false virgin. In case of professional misconduct, the patient's records on demand should be provided within 24 hours. Or no, not 24, within 72 hours, 3 days. If a doctor does not maintain medical records of the patient for a period of 3 years, he should maintain the records. 3 years. The fast should give within 32 hours. A registered medical practitioner is requested by a survivor or sexual violence to examine her. Within what time must the practitioner take a vaginal swab to look for the presence of hematoma? So within 72 hours after an assault, 3 days. However, vaginal swab can be taken within 96 hours to remove semen. Evidence on the outside of the body and on material such as clothing can be collected even after 96 hours. According to POCSO, aggravated sexual assault includes gang penetrative sexual assault, all of the above statements done by police officer. So, sexual assault done by police officer is an aggravated sexual assault according to POCSO, Protection of Children from Sexual Offences. Defines a child as any person below 18 years of age. It defines various forms of sexual offences, which include sexual harassment, threatening, assault, any act with sexual intent involves physical contact without penetration. Similar sexual assault along with criteria explained under the term aggravated. Penetrative sexual assault an act with sexual intent that involves physical penetration of the penis or any object into vagina, mouth, urethra or anus. Aggravated sexual similar to sexual assault along with criteria under the term aggravated. So it is all of the above. Name the type of skull fracture. The image shows hinge fracture, motorcyclist fracture, where the base of the skull is divided into two halves, each moving independently of the other like a hinge. So it is hinge fracture. Hinge fracture. In hinge fracture, base of the skull divided into two halves, each moving independently of the other. Bullet fingerprinting involves primary markings, secondary markings, both. It involves both primary and secondary. Primary markings are found where the bullet passes through a barrel and the sides are marked by rifling of the barrel, which is specific to the make and model of the gun. Irregularities on the inner surface of the barrel check, which is specific to that particular weapon, are also seen on the bullet and upper secondary markings. Identify the injury in the given image. It's just a gravel rash, it's an aberration. It's an aberration. An aberration is the most superficial injury, okay, and it does not penetrate the full thickness of the epidermis. So pure aberration does not bleed, blood is also confined to the dermis. However, the dermal epithelium are corrugated in nature, thus many abrasions enter the dermis and bleeding occurs. What is the cause of death in smoke inhalation? If smoke has effective carbon monoxide permits any hypoxia. Okay. Higher affinity carbon monoxide with hemoglobin is compared to oxygen. Paradoxical undressing is seen in hypothermia. Is seen in hypothermia. Hypothermia victim when the temperature is too low, the person take out his coat. No, not that one, but it's different one. So in paradoxical undressing, and because of the low temperature, the person, yeah, the person because of the low temperature, the person immediately feels hot and he take out his cloth and then hide in some place. So it seems to be like a case of suicide, but it is not suicide. The currents are attributed by distance paradoxical heating. For a short period, the person will feel the heat, so they take out the cloth. So maybe to erroneous assumption of sexual offense, but it's not that. Fatal hypothermia induced by loss of powers of judgment, disorientation, to interpretation associated with the phenomenon, with this phenomenon. Okay. This one is again asked in age 2019. This one is again asked postmortem lividity. So this is postmortem lividity of called circulation. Paradoxical this is seen in hypothermia. The plant which produces delirium toxin, it is datura. Datura. 11-year-old girl was found to be quiet and shy in her classroom with intermittent crying for the past 2 days. Her uncle was touching her genitally and realized the duty of the principal is to report this to magistrate. Which of the following postmortem? Oh my god, all questions are wrong. 1 second, I have put something else here. 1 minute. That's what I was not able to believe into the answer. Yeah, circulation. The phenomenon of paradoxical hypothermia victims. This one is Ethoxylum coca. This is the coca plant. Okay, Ethoxylum coca. 11-year-old girl. Okay, so to whom the principal should report? She should report to the police. You should report to the police itself. Okay, sexual assault, harassment, pornography. Safeguarding investigation at every stage of the judicial process. So, child-friendly investigation should be there to be reported to the police. Okay. So, the following postmortem changes is shown in the given image. Yeah, this one is marbling, superficial veins. The blood in the vessels is homolyzed sulfhydroxide. That one is found, okay? Bullet wipe. What is bullet wipe? Is due to grease, soot, or debris from the barrel of the gun. The clothing of victim of bullet injury is reported in various acids surrounding the entrance before at various stages humans will it helps in determining the range of heat and outlet upon the body. So it's a residual from barrel of gun. Heat or debris in the barrel of gun. While examining the clotting of victim of bullet injury, there is a report of various acidic entrance defect at various stages known as bullet bite. Helps determine the range of inlet upon the body. A 28-year-old man presented with a dry mouth. Okay, urinary retention and constipation after consuming an alone substance examining. Okay, his pulse rate high, pupils so dilated. Most likely it's a poisoning of Atropa belladonna, atropine poisoning. Belladonna. It inhibits the muscarinic effects of acetylcholine. All parts of the plants are toxic. Active principles higher thiamine, morphine, and marathon can cause constriction of the pupil. Next. Identify the type of skull. Next, we're moving on AIMS 2020. AIMS 2020. Good question. 18 questions were asked. Which type of fracture it is? It is a period fracture. Period fracture. A middle-aged man who brought to the ER after an assault with a sharp edge. Oh my god. Identify a wound. So, so, so chop wound. Chop wounds are so called because of the action which they are produced depending on the shape may resemble answer and etc. The shape of the wound may give clues to the type of weapon. It will be a deep, well-marinated wound, keeping the limited damage surroundings. Which of it is very sharp. A patient comes to the casualty with life-threatening injuries. There was no time for taking concern. The doctor started doing life-saving procedures and despite best effort, the death of the patient occurred. Under which doctrine? Conjugating answered. So, under IPC 92, can perform the doctor can life-saving procedure in patient while with life-threatening injuries without obtaining consent. The guiding principle is when the delaying treatment in order to obtain consent will result in harm to the patient. The doctrine of anticipation, called doctrine of anticipation. If some physical and emergency something consent will be neither possible nor necessary. Okay. So the following is false regarding the management of snake bite in India. Management of snake bite in India. So what we give? Atropine is not useful in the management of crate bite. Common crate venom acts presynaptically, hence atropine is not. Cobra venom acts post-synaptically, atropine can be used to mimic. For cobra you can use. Atropine not for crate bite. Neostigmin and motility support are used in treatment along with age mainstay of treatment. AC used in India is effective against cobra, crate, viper, saw, etc. Support is used in the treatment of bite. Question number 4 answer is A. False regarding the so A is false. Because atropine not used for crate. 14-year-old girl comes to the OPD with her mother. History of penovaginal penetration by the neighbor is reported by the doctor. Admits to giving the neighbor the consent for the same. He says she does not want to be examined. The following should you do? C1372. The scenario describes 14-year-old girl with a history of sexual intercourse with her neighbor, albeit with consent. Consent for intercourse is valid only after 18 years in an unmarried girl. She is less than 18 years assumed to be medico-legal case of sexual assault. Victim of assault should be done after the consent of the victim. She is less than 12 years of age or unsound mind. Consent from the guardian needs to be taken. Examination. For examination, consent from the guardian need to be taken. If she denies examination, counseling has to be done regarding the need of injunction, how it could help up against her in the court of law. If she still refuses for part of whole of examination sample correction, refusal needs to be documented. Information to the police is given in all medical legal cases. Surgeon performs a hysterectomy for uterine fibroids. After obtaining relevant information consent from the patient despite adequate precautions, the ureter was injured intraoperatively. Under which of the following results will the doctor not be held responsible for this act? So will not be responsible under medical malacquerence. Medical malacquerence is an inevitable accident. Every human being responds differently in different circumstances, treatment modalities. On certain occasions, despite all proper care given by the doctor, treatment the patient fails to respond properly or less effective. Those patients will be which may lead to severe injuries following different cases of malacquerence or inevitable accident. If the doctor can prove this before the court, the absolute defense against malpractice. Yes, it's a Twitter for the death of a patient by spurious drug. Used reduce imprisonment for life. That when used for personal in the case of diagnosis and mitigation or prevention of any disease or disorder. So life including judgment. Identification of this seed. What are these seeds? These seeds are Kalanji, Nigella sativa, Nigella sativa, Kalanji. A 12-year-old boy presents with the following injury. Christine on being tackled by opponent during the course of football match. The medical officer you would enter the room description the cases. It don't look like aberration. It is not aberration. It's an aberration. After the two hospitals notice on the scene and the death is coming and covering with the film poster, the days were done first. You are posted during consulting and emergency cases that means with the point that she has to prove the death. What would be mark will achieve cause of death? So it's okay in case of drowning. Drop is coming with a flash. Traumatic asphyxia there is a knee fraud, strangulation knee fraud, hanging knee fraud, like that. So question number 10. Answer is drowning. Drowning. No clear signs of facial commentary. What is the approximate age of a person whom the medical end of the clavicle, medial end of the clavicle is fused and also the sternum is completely fused? Okay, so medial end fused, sternum completely fused sternum. It's 25 years, approximately 25 years. Condition shown, and this looks like a filigree bones. It looks like a bone. Postmortem marbling. After we can take this postmortem marbling. Okay. The image shown below. This is shotgun gun with range a long distance. Who's founded it? So this is the case of strangulation. Strangulation by ligature. Throttling, not throttling. Carotid antibody or muscle hematoma, nail marks or absence of ligature mark. So there is no ligature mark, na? Throttling. Okay. There is no ligature, but nail marks are there. No ligature. And another important thing is there is intimal tear, muscle hematoma. So throttling. thirdness by using hand. Fixing the legs structure. Okay. So the following is in fresh water zone. So how am I framing the question? Freshwater hyperkalemia seen due to hemolysis of swollen analysis, not hypothyroidism. Freshwater is hypotonic to plasma and is affiliated with here you are working as a medical officer PhD, 17-year-old girl presents you after an analysis of your called the girl refused physical. Why these girls are refusing physical examination? Man, the following poison this question is incomplete. Okay, we'll end here because this one is not, this one is this one. So the which is the first organ to petrify? First organ to petrify is brain. Last is post-sphenoid, which was the brain. First is larynx and trachea, stomach, intestine, skin, liver, lungs, then brain, then heart, then kidney and bladder. The prostate and uterus, then skin, muscles, and lymph. The following constitutional article is not related to children. 21A is right to free and compulsory elementary education to 14 years to protect it from any hazardous employment to the age of 14. 29E is about right to be protected from being abused. Right to equal opportunities and facilities. McNaughton's rule falls under which section? BNS Bharatiya Nyaya Sanhita IPC 84 section 22. Section 22 option B. Intellectual factors are considered but emotions, issues and control of impulses are ignored. So these are the two points which you get. Since tools are associated with which of the following? Acute phosphate poisoning, Vincent steel, limited species, enemies in the dark. Phosphate poisoning, phosphate. No other phosphate in the graveyard. So the following poison causes bleed, discoloration of the stomach, mucosa, postmortem examination of the stomach mucosa. Okay. Sodium amytal poisoning. Okay. Saturnin gout is seen chronic lead intoxication in school. At what age Betsy or put fused with Betsy Spinard? It is 22 years. Edmond Locard is most famous for for he's famous for exchange of Lucas systems principle.